بسم الله الرحمن الرحيم. Our topics about benign and malignant lesions of the cervix. Cervix is a tubular structure. It is composed of stromal tissue which is lined by squamous epithelium in the vagina اللي هو الectocervix and columnar epithelium within the cervical canal اللي هو endocervix. The meeting of the two types of the epithelium is called squamo-columnar junction, and this is usually at the ectocervix. هذا squamo-columnar junction هذا، وهنا يصير الاريا اوف ectopic. الديزيز كله يصير هنا هذا المكان. The position of the squamo-columnar junction changes throughout the reproductive years. In children, it lies at the ectocervix, that is just at the external os. At puberty, due to estrogen effect and during pregnancy, it extends outwards as the cervix enlarges, and in adult life, it returns to the ectocervix through the process of metaplasia. The transformation zone is an important area on the cervix, which is defined as the area where the original squamo-columnar junction was to the current squamo-columnar junction, and it includes area of metaplasia. The transformation zone is the site where pre-malignancy and malignancy develop. Benign cervical lesions اللي هم cervical ectopy or ectoropian, cervicitis, cervical cyst, cervical polyps, cervical fibroid, and cervical stenosis. الcervical ectopy or erosion هاي مثل ما تشوفوها هسه بصورة هاي cervical ectopy or erosion. Endocervical epithelium advances on appearance. Ectocervix, bright red, soft, occurs more in adolescence, pregnancy, use of oral contraceptive pills, can also result from labor. Most cases asymptomatic, can cause leukorrhea and postcoital bleeding, with treatment only if symptomatic, radial diathermy or cryosurgery, coagulation. Management if asymptomatic include reassurance and exclude other causes. Complications: secondary hemorrhage, infection, cervical stenosis. الcervicitis عندنا non-specific condition مثل ما تشوفون, difficult to define, common clinical diagnosis. The cervical cyst أو Nabatean cyst. The majority of cervical cysts are Nabatean cysts, which are clear to yellow white elevations of the endocervix or proximal ectocervix, rarely more than 1 cm in diameter. They contain mucus مثل ما تشوفون هنا. هذه النابوثيان cyst شلون واضحة هذه هاي هنا by ultrasound, appears by ultrasound. الميزونيفريك other cyst اللي هي الميزونيفريك cyst, remnants of Wolffian ducts extend deeper into the cervical stroma and are more commonly found on the ectocervix. Endometriosis, red purple in appearance, and any associated symptoms will worse within days of menstruation. Cervical cysts do not need to be removed unless they are symptomatic or they interfere with blood testing. Cervical polyp مثل ما تشوفون هنا هذا another polyp, asymptomatic and almost always benign, detected on cervical examination, performed for other purposes. يعني مريضة جاية تفحص على غير شيء نشوفها accidentally إن عندها cervical polyp. مرات تسوي لنا symptoms اللي هي postcoital or intermenstrual bleeding. The management is removal, polypectomy. Concern is that bleeding from cervical polyps may mask other sources of bleeding originating from more problematic sources. Cervical fibroid مثل هذا هيك يصير, وهذه by ultrasound. Cervical fibroid. Cervical fibroids, histologically, cervical fibroids are identical to those found in the uterus. Depends on size, intermenstrual bleeding is common. Large fibroids may cause dyspareunia, bladder, rectal pressure, and obstetrical complications. Diagnosis, sonography and hysteroscopy. Management is to screen for cervical cancer and elective removal if symptomatic. Monitor with regular gynecological visits. Cervical stenosis, narrowing or obliteration of the cervical canal, may be congenital or acquired. Congenital segmental Mullerian hypoplasia of the clinical feature of vaginal atresia. Acquired trauma during obstetric post-operative obstetrical procedure يعني post-operative by lead conization DNC infection radiation and atrophy. Signs and symptoms. Mild cervical stenosis is asymptomatic. Severe cervical stenosis can present as cryptomenorrhea, secondary dysmenorrhea, infertility, obstetrical complications. The diagnosis: inability to pass a 1 or 2 millimeter probe into the uterine cavity is diagnostic for cervical stenosis. then يشوفوا دايليترات يسموهم هيجاز دايليتر، مختلف الأحجام، يبدي بواحد بالبداية بالصغير شوي شوي يتدرج الكبير اللي هي نسوي بيها cervical dilatation. السيرفايكال نيوبلازم اللي هي البري مالجنانت عن مالجنانت سيرفايكال ليجن. هسه راح نجي على السيرفايكال سكرينينج عن ديسبليجيا. هسه لازم نتعرف نسوي definition عن terminology المصطلحات اللي راح هسه ناخذها حتى تفهمون شنو كل مصطلح احنا نحكي. السن يعني cervical intraepithelial neoplasia. الديسبليجيا a histological term describing architectural abnormalities within the tissue. Dyskaryosis cytological term describing the nuclear abnormalities not synonymous with dysplasia. Metaplasia physiological process whereby columnar epithelium is replaced by squamous tissue in response to the acid environment of the vagina. The squamo-columnar junction where squamous and columnar tissue meets. This is not fixed but is affected by metaplasia. هسه نيجي على السن اللي هو cervical intraepithelial neoplasia. Sin is a condition characterized by new cellular growth, neoplasia in a normal tissue. Once sin is diagnosed, this alarms us. عادي تعطينا تنبيه that an abnormal tissue has been diagnosed in the cervix of that lady. The most important causative factor or triggering factor هو human papillomavirus, which could cause other combined genital and anal cancer. Approximately 95% of squamous intraepithelial neoplasia occurs within the T transformation zone. However, sin is much more common than the other types of genital neoplasia. The tissue changes associated with sin signify the presence of pre-malignant or precancerous lesion. That means sin is essentially a precursor to invasive cervical cancer and is collectively composed of cells that have undergone abnormal individual changes, that is, with abnormal mitotic activity and leads to formation of a lesion in the cervix. Etiology: human papillomavirus infection is the essential prerequisite for the development of cervical malignancy. The human papillomavirus infection is extremely common, with up to 80% of sexually active women being human papillomavirus positive at some point during their lifetime. Using the incidence of genital wart as a marker, the incidence appears to be rising 5-folds in the female population and 8-folds in the male population, with approximately 15% prevalence of the oncogenic human papillomavirus types 16 and 18. However, most infections are usually transient, with 90% of women clearing the infection within 2 years, and young competent women are able to eliminate the infection. Risk factors مهمة جدا بالسيرفايكال أو بالسن اللي هي نفسها بالسن وبالسيرفايكال كانسر. Smoking reduces local cervical immunity. multiple sexual partners, having a partner with multiple sexual partner or with sexually transmitted disease, presence of other sexually transmitted disease like like HIV and genital herpes, long-term use of contraceptive pills, and immunosuppression or use of anti-cancer drugs, being born to mother used diethylstilbestrol. Clinical features: often it is asymptomatic and diagnosed during routine annual pap smear, non-specific, genital lesion like wart, abnormal lower genital bleeding and abnormal vaginal discharge, vague lower abdominal pain. Pathophysiology: metaplasia is a normal finding, but this may be disrupted by some factors like human papillomavirus, smoking or immunosuppression, and etc., and lead to development of disordered squamous epithelium called dysplasia, which characterized by lack of normal maturation of cells as they move from basal layer to superficial layer, large nuclei, more variable in size and shape, high mitotic activity means more rapidly dividing cells. In natural history, regression and progression of sin may occur. Spontaneous regression of low-grade disease is common and is likely to occur through the patient's own cell-mediated immunity. The high-grade lesion is less likely to regress spontaneously and requires treatment as there is risk of regression to cancer. Natural history of human papillomavirus infection and sin. In about 1 year, initial human papillomavirus infection, either 20% about up to 5 years change to persistent infection, or return to sin 1 and cleared human papillomavirus infection. معنى بالinitial infection 65% human papillomavirus 16 cleared human papillomavirus infection, or progress or regress to up to 20 years into sin 2 and 3, 15% cancer, human papillomavirus 16, 18 and 30s, either progress to cancer or regress to sin 1 or cleared human papillomavirus infection. If left untreated, 20% of patients with high-grade abnormalities may develop cancer of cervix. Reasons for this remain unclear, but may include reduced host immunity, oncogenic human papillomavirus, and smoking. هاي هنا بالترانزيانت انفكشن. شوفوا هنا human papillomavirus persistence. هاي مبينة واضحة جدا نعدها invasion. Screening, even the most severe sin 3, takes many years to change to cancer. This means we can apply screening tests to do early detection of pre-malignant condition and do appropriate treatment and follow-up. Pap smear cytological screening methods اللي هي conventional brush, spatula, slide, thin layer using liquid-based cytology, and more sensitive DNA typing of human papillomavirus can be done. Computer-assisted automated cytology and hybrid capture to human papillomavirus DNA testing. Screening test اللي هو pap smear or cervical smear cytological test described by Papa Nicolai using a brush and Ayers spatula. هاي Ayers spatula هذه وهذه البراش. Pap smear cells are scraped from the cervix and examined under a microscope to check the disease of other problems. The cervical viewed through speculum with patient in lithotomy position here, and then first patient in lithotomy position, putting the speculum and then take the sample by brush or Ayers spatula, which is spread over the slide with fixation and examination. هذه another method by brush شلون بيسوي spread on glass slides as thin as possible, properly labeled, fixation of samples immediately with alcohol. Cyto brush insert 2 cm until brush is fully inside cervical canal مثل ما تشوفون هنا. Rotate only 180 degrees, otherwise will cause bleeding. ننفرها باتجاه 180 درجة ولا يصير bleeding. Routine pap smears. The first pap smear should take place at age 21 or 3 years after the girl's first intercourse, whichever is younger. After the first pap smear, subsequent paps should take place annually until at age 30. Starting at age 30, once the patient has had 3 consecutive normal paps, then she may receive a pap every 3 to 4 years, as long as subsequent paps are normal. If she has an abnormal pap, however, she must return to annual screening until she has 3 consecutive normal paps again. The starting age 65 years. If the patient has had 3 consecutive normal paps, she may discontinue paps indefinitely, provided she does not meet certain criteria. If the patient has had total hysterectomy, not performed for reasons of cancer, she may discontinue pap indefinitely, provided she has not had an abnormal pap in the past 20 years. Women with significant risk factors for cervical cancer should be discouraged from discontinuing paps, for example, IUCD or diethyl posterior exposure, HIV, or immunocompromised chronic steroid use, etc. The Bethesda system epithelial cell abnormalities. شو راح نشوف الريزلت ايش تطلع، يا اما نيجاتيف نولم نسميها نورمال، يا اما اسك اس او يا اما اسك اتش او السلسل او اتسل او كانسر. خلينا نعرف شنو يعني. الاسكس يعني atypical squamous cell of undetermined significance. الاسك اتش اللي هي atypical squamous cells of highly significance. low grade squamous intraepithelial lesion، هذه high grade squamous intraepithelial lesion هنا الكانسر أو كارسينوما انساتشو. وعندنا بعد الأدينو كارسينوما. Now pap smear is superseded by liquid-based cytology, where a small brush is used to sample cells from the transformation zone, and the brush head placed in the fixative. This is then spun down and read by cytologists. Normal cervical cell has a small nuclei that is flattened and pycnotic, but abnormal cell has large nuclei, cytological atypia, and high nuclear to cytoplasmic ratio. With the exception of ascus, all abnormal paps will proceed to colposcopy and biopsy. يعني كل الباب سمير اللي هي abnormal احنا نحتاج نسوي لها colposcopy، ما عدا الاسكس ما نسوي لها ولا follow up. Women with ascus should get an human papillomavirus DNA test. If this is positive for high-risk human papillomavirus, she should get colposcopy and treatment or colposcopic biopsy. Otherwise, pap and human papillomavirus DNA may be repeated next year. إذا ما عندها risk factor. هاي بالنسبة للأفكاس بنحكي هنا. بقية متفقين إنه كلهم نسويهم. Patient with agas or atypical glandular cells may need endometrial sampling depending on age and history. The sensitivity of cervical smear in picking up women with SIN is around 70%. However, as there is slow progression for most women with SIN to cancer, if a lesion is missed, then this should be picked up on subsequent smear. The specificity is 90%. If the test is negative, the patient is replaced or routine recall. If the smear shows low-grade changes, the patient offered repeated tests in next 3 to 6 months and managed accordingly. And if this shows high-grade lesion, the patient is urgently referred to colposcopy. Colposcopy is the outpatient examination of the magnified cervix using a light source. It is used for both diagnosis and treatment. After inserting a speculum, the cervix is examined using binocular operative microscope under magnification of 5 to 20 times. In colposcopy, 5% acetic acid is applied as it causes nuclear proteins within the cells to coagulate. Therefore, areas of increased cell turnover, for example, sin, will appear white. هاي مثل ما بتشوفوها، هاي أسيتو وايت اريا هنا، هذه اللي هي صارت وايت. Schiller test by application of iodine, areas of sin lack the presence of intracellular glycogen and therefore are stained yellow as opposed to normal which is stained brown when iodine is applied. شوفوا هنا راح تصير هذه اليلو الوايت اريا، بينما البقية ايش راح تنصبغ؟ راح تنصبغ نفس صبغة الايودين. البيوبسي is taken from the most abnormal site. Colposcopy is deemed satisfactory if transformation zone is viewed adequately and unsatisfactory if not viewed adequately. What you are looking for in colposcopy and biopsy: areas that stain white with acetic acid، هاي اللي هي الأسيتو white area. Areas that are mosaic-like in appearance و areas that display punctated vessels. Area with abnormal vessels geography form bizarre shape. هسه هذه areas that are mosaic-like in appearance شوفوها مثل الموزايك، أو نشوف area with punctated blood vessels، هاي النقاط منقطة مثل الفراولة شكلها، أو شو نشوف area with abnormal vessels geography bizarre shape، يعني تكون مخربطة هذه blood vessels. شوفوا هنا العفو، نرجع على هاي الصورة، شوفوا تصير مثل التري. عادة الشجرة العادية تكون الجذع مالتها غليظ والأغصان تكون تبدي شوي شوي تصغر كل ما ابتعدنا العفو. هنا بالعكس احنا نشوف هنا الغصن هو المتين والجذع نشوفه شوي شوي يضعف كل ما اقتربنا، يعني بالعكس نشوفه، لهذا يكون bizarre shape. From the histologist will assess the biopsy and label it based on the depth of abnormal cellular invasion. These designations are based on the depth of the abnormal cells and importantly whether or not the basement membrane is intact. Always compare the result of pap with histology. It is wrong if the pap smears worse than the biopsy, so we may miss the area that had abnormal cells. Sin from the histology, either sin 1 or 2 or 3. Sin 1 minimal dysplasia, sin 2 moderate dysplasia, while sin 3 severe dysplasia or carcinoma in situ. شوفوا هاي 2 هاي 1 2 هذا 3. carcinoma in situ invasive carcinoma. Continuum of dysplasia to carcinoma. السن 1 mild dysplasia، راح نشوف هنا البيزمنت ممبرين يكون intact بالسن 1. السن 2 moderate dysplasia. السن 3 severe dysplasia almost full thickness، ياخذ كل السن 3 carcinoma in situ full thickness. أحسن وراها بالinvasive carcinoma راح نشوف basement membrane راح تطلع من عند السيل تصير invasion. مثل ما تشوفون هنا هاي النورمال سيل، هذا البيزمنت membrane. بعدين وراها شو راح يصير؟ راح تبدي اتيبيا تصير اتيبيكال نيوكليير وسيتوبلازميك. الستيج 2 راح يكون الثيكنس أكثر، والستيج 3 تشوفوا كليته فول ثيكنس سيفير. Classification of sin. A revised classification has been introduced. Low-grade lesion, sin 1, and human papillomavirus associated changes with unknown but a likely low progression potential. High-grade lesion, sin 1, sin 2 and sin 3 that is likely to behave as a cancer precursor. Simpler classification is according to Bethesda divided to low-grade squamous intraepithelial lesion اللي هي الألسر أو high-grade squamous intraepithelial lesion الإتسل اللي هي sin 2 and sin 3. مثل ما تشوفون هنا هذه اللو-grade هذه اللو-grade sin 1 اللي هي very mild dysplasia أو mild dysplasia والsin 2 اللي هي moderate dysplasia والsin 3 اللي هي severe dysplasia والكارسينوما إنسايتشو هاي كلها high grade squamous intraepithelial lesion. Human papillomavirus DNA testing is the main causative factor of sin and cervical cancer. Recently, detection of human papillomavirus DNA in serum has been introduced to screening program. The detection human papillomavirus DNA test hybrid capture tool can be analyzed from the residual fluid of a liquid-based cytology specimen, detects high-risk human papillomavirus types, but does not identify individual type. The indication for use is routine adjunct to PAP in women 30 years and over and management of ASCAS. هسه احنا بعد ما سوينا السن وسوينا الباب سمير وسوينا كولبوسكوبيك بايوبسي ايش راح نسوي هسه؟ What to do? Or what do I do? Now what to do? The histologic diagnosis provides the information you need in deciding what therapeutic interventions should be taken as well as information regarding prognosis and surveillance. The sin 1 may repeat PAP at 6 and 12 months or get an human papillomavirus DNA at 12 months. Abnormal results, repeat colposcopy and biopsy. Normal results may return to annual pap smear. The sin 2, 3 and carcinoma in situ will all necessitate surgical resection. There are various methods which may be chosen based on the locations of the lesion and the age of the patient. The most common procedure is the loop electrical excision or leap excision. The treatment, dissection of the lesion and whole transformation zone. This is achieved by cryocautery, electrocautery, diaphragmicautery, cold coagulation, or laser. The cure rate is about 95%. Excision of the lesion and whole transformation zone. This is carried out by laser or by diaphragm loop, large loop excision, large loop excision of the transformation zone, also called loop electrosurgical excision اللي هي الليب مثل ما تشوفون هنا excision by lead. Conization that the cure rate is 99%. It is superior to local dissection and preserve fertility. Indications of con biopsy. PAP worse than histology يعني نشوف الباب نسوي الباب نشوف النتيجة مالتها مثلا أتصل بينما الهستولوجي يطلع مثلا أتصل. هذه indication for conization يعني معناها احنا ما واخدين بايوبسي يجوز من المكان الصحيح. الإكزوسيرفايكال biopsy show abnormal cells. The lesion enter endocervical canal in colposcopy and biopsy show microinvasive carcinoma. The risk of deep conization أولا cervical incompetence وثانيا cervical stenosis. The cold cone biopsy, a large area of tissue around the cervix is excised for examination. Hysterectomy is rarely done. The indications are women above 40 years, patient requesting sterilization, and the presence of associated pathology needing hysterectomy as fibroids, when it is difficult to follow up the patient by cytology or colposcopy. Residual lesion after treatment. However, residual disease can be treated by repeating local dissection, local excision, conization, or hysterectomy. If the lesion involves the upper vagina, Treatment is hysterectomy with removal of upper part of vagina. Alternative to this is conization and laser dissection of the vaginal lesion. Some gynecologists treat SIN1 conservatively. In this case, cervical smear is repeated every 6 months and an associated infection is treated. SIN1 becomes invasive in about 15%, progresses in about 30%, and remains unchanged in the rest. Follow-up by cytology every 3 months for 1 year, and then every 6 months for 5 years, then yearly for 10 years, as the risk of recurrence and cancer is remains. شوفوا هذا natural history of SIN lesion. SIN1 60% spontaneous regression, while persist 30%, NANA 10% progress to SIN3, and less than 1% progress to the invasive cancer. Okay? Human papillomavirus vaccines. Recently, human papillomavirus vaccines have been developed to prevent primary infection with certain oncogenic human papillomavirus types اللي هي 6 11 16 18 31 33. هذه كلها مهمة strains حتى واحد يفهم. In many countries have a national program with the sole aim to reduce death rate. The evidence to date suggests that the vaccination is not only effective in preventing the development of high-grade SIN, but is safe to be given to female 9 to 26 years old, ideally before onset of sexual activity. 3 IM injection over 6-month period. It is debatable. هسه نيجي عن invasive cervical carcinoma. Incidence it varies between 15 to 35%. لكل per 100,000 females per year. It varies considerably from country to country and from race to race. The commonest age incidence is 45 to 55 years. The tumor, however, can occur at any age, and it is reported that there is another peak at the age of 35 years. Etiology, the cause of cervical cancer is unknown, but the predisposing factor similar to SIN. Besides carcinoma of the portio vaginalis or ectocervical carcinoma 90%, it arises from squamous epithelium covering the vaginal portion of the cervix and always starts at or near the squamo-columnar junction at the external os transformation zone. The endocervical carcinoma اللي هي 10%, it arises from the columnar epithelium lining the cervical canal or cervical gland. The mode of spread: direct spread, lymphatic spread, blood stream, surface implantation, seeding. The causes of death from cervical carcinoma هذه مهمة. Uremia, the commonest cause of death. يعني هسه عندنا risk factor مهمة وعندنا causes of death from cervical cancer هم مهمة جدا. The commonest cause of death 50% due to bilateral urethric obstruction and urinary tract infection, malignant cachexia, infection as paramyositis, peritonitis, or septicemia, severe hemorrhage from eroding big vessels, pulmonary embolism due to infection and thrombophlebitis, metastasis in vital organs as liver or brain. Complication of treatment: the primary mortality from birth time operation is about 1%, and from radiotherapy is less than 1%. Diagnosis: symptoms يا أما asymptomatic يا أما vaginal bleeding. It starts as contact bleeding occurring after coitus, douching or vaginal examination. Later on, the bleeding is irregular and variable in amount. Vaginal discharge is the second commonest symptom. It is slight and watery. Later on, it becomes a blood stain and offensive due to ulceration and infection. Vaginal mass and dyspareunia أو يا أما pain. It is late symptom. Early symptoms: none, thin watery blood يا أما none هي symptomatic أو thin watery blood vaginal discharge, blood stained foul vaginal discharge, abnormal vaginal bleeding, intermenstrual, postcoital or perimenopausal or postmenopausal. Late symptoms: pain due to spinal cord infiltration, leg edema. Urinary and rectal symptoms: يصير عندهم dysuria, hematuria, incontinence due to fistula, rectal bleeding, constipation, hemorrhoids, uremia due to urethric obstruction. Signs: general examination. This may show cachexia, evidence of uremia, supraclavicular or inguinal lymph nodes, metastasis, and edema of lower limbs, which indicates lymphatic obstruction in the pelvis. ثانيا, abdominal examination. The abdomen should be carefully examined for enlarged liver, kidney, abnormal masses, abdominal masses, and ascites. The pelvic examination in early cervical cancer may reveal a cervix that appears normal, especially if the lesion is endocervical. Visible disease may take several forms: ulcerative lymphatic, granular, or necrotic. Investigation. In the cervical biopsy, cystoscopy to diagnose infiltration of the bladder, done as a routine in every case, sigmoidoscopy or barium enema if there are bowel symptoms as pain or bleeding, chest X-ray is done routinely, intravenous pyelogram to show the condition of the ureters and kidney function, computerized tomography CT scan to the pelvis and abdomen. It shows the size of the tumor, infiltration of the parametrium, metastasis in the pelvic and aortic lymph nodes, and liver, and diagnosis hydronephrosis. Magnetic resonance imaging is more accurate than CT scan, but it is costly. Bone scan, not done as a routine, but only when symptoms or signs suggest metastasis. Estimation of serum tumor markers, cancer antigen CA125 and another detect recurrence. Examination under general anesthesia must be done to determine the extent of the growth. It is essential for a clinical staging. هذا الفيجر staging of cancer مجرد تطلعون عليه بس تشوفون يعني الديزيز وين، يعني ما مطلوب لي الحكم. Summary of treatment. Stage 1A1, simple hysterectomy or conization. Stage 1A2, extended hysterectomy. Stage 1B and Stage 2A, vertebral operation or radiotherapy. The treatment is individualized. For example, if the patient is young, surgery is preferred to preserve ovarian function and allow normal intercourse, as radiotherapy destroys ovarian function and causes vaginal stenosis and dyspareunia. Stage 2B, radiotherapy. Stage 3, radiotherapy. Stage 4, palliative treatment, including palliative radiotherapy. Pelvic extension is a major operation during which all the contents of the body cavity are removed. Pelvic extension refers to the removal of the pelvic organs, chemotherapy, and drug to relieve pain. The overall 5 years survival following therapy: Stage 1, 80%, Stage 2, 50 to 60%, Stage 3, 30 to 40%, while Stage 4, 4%. Thank you very much.